Hi, I'm Dr. Mark Studin, and welcome back, hopefully welcome back, to our video tutorials on practice success. Today I'd like to spend a few short minutes talking about range of motion. Range of motion is perhaps the universally held standard for functionality or functional loss or persistent functional loss or showing a continuity of care that gets better. Now, first when we look at range of motion, we go to the American Medical Association guides to the Evaluation of Permanent Impairment, both 5th and 6th editions. Now, in the 6th edition, it doesn't count range of motion towards impairment, but it refers you back to the 5th for range of motion issues and standards because it's an important part of following the continuity of care. Page 400 on the 5th edition really sets the tone and lets you know that you need to use a two-piece inclinometer for spine. When it comes to goniometers, that's extremities. It's not valid for spine. Arthrodial protractors, nope. And in visual, yes, it's valid, but you can only report normal or restricted. And if you're going to use range of motion and use a degrees, in other words, 40 over 60 or 20 over 40, whatever, you need to use a two-piece inclinometer. It could be analog or digital, connected to a computer or not, but it's very important. When you're dealing in the world of personal injury, the most stringent standard in the country for an attorney to bring a case to trial, and again, we're a country of laws, and our practice really is predicated upon the courts. So the courts say, in the most difficult state, that in order to show that there is an injury, you need permanent impairment of body part or function. And range of motion has been accepted as a permanent impairment. Now, if you want to get fancy, we've already talked about Colossus. They talk about loss of enjoyment of life, or that which has persisted after a reasonable course of care is concluded. Range of motion is part of that, okay? After a reasonable course of care is concluded. So when you're trying to determine if more care is necessary, range of motion is one valid indicator. As long as you're moving in a positive way, in other words, it might be 20 over 40 month one, 25 over 40, 30 over 40. You're showing progress. You haven't plateaued or hit MMI. When you plateau, and my standard is 2 reevaluations, which are 30 days apart, that shows the same range of motion, for that region it will plateau. Unless I need to look at something else that's going on, I might look at muscle testing. But range of motion is pretty much a true and accepted standard universally across all professions. So when you're doing your examination, your E&M code 99202, 203, 204, 2122, etc., eval or reeval, range of motion should be in there, whether it be visual or by degrees, but follow the rules. So look, I really look forward to sharing these few minutes with you, and we'll see you on the next installment. Thanks and have a great day.